Okay, so the unit is up and running. You'll notice this is the main home screen that we're brought to. You've got three options, three main menu options that you can choose. You can either choose to run a new study, you can choose to review completed tests, or the end goal here is you would have a user guide that you could actually have video tutorials much like this one play right from the screen. So I'll simply start by touching New Study to initiate a new test. So the first page that you're brought to is the patient information page. Now every field with an asterisk is required. If you try to advance to complete the study without entering the required information, you will be prompted with a message letting you know which information is still missing. So I'll simply type in a subject ID. Now this, for HIPAA purposes, should not identify the patient, should not be their name. So either their social security number or your patient ID number. So I'll enter in some ID number here. To advance to the next field, you can either choose the tab button here, or as I'll demonstrate, you can press OK and then select the next field to be entered. So for last name, again, I will put in last name. I'll choose the next field to go to the first name. And then I can continue advancing through the tabs, entering information as needed. But again, I will focus on the required information being subject ID, patient name, age, and gender. So typing in patient age, and lastly, I'm choosing a gender from the drop-down menu here. As soon as all of the required information has been entered, you can then press the next button to take you into the next page. Now, the CardioHealth station does calculate a Framingham risk score, so it's a traditional risk factor assessment. For that, we do require certain questions be answered regarding the patient. So just simply ask the patient about the questions here and then just choose their answer as they answer. So, smoker, yes or no? Are they currently on high blood pressure medication, yes or no? Do they have diabetes, yes or no? And is there a history of premature heart disease in the family? Now, if for any of these questions the patient is unsure about what the question means, you can simply choose the underlined text for a NIH guideline essentially for that question. So this can be read aloud to the patient. In most cases they will understand that. And then since we do trend the IMT value against population data, we do require the patient's race as well. So I would choose that here. We also have the ability to take a full medical history of the patient. So this is per the NIH website. You can just simply choose a disease or condition, specify the disease if it's, in this case, diabetes. You know which kind of diabetes, what type of diabetes it is, age of diagnosis, and then you can simply add or remove as many conditions as you have for that patient. You even have the ability to enter the patient's contact information, mailing address, email address, and so forth. And any information which you enter will be stored within the machine. It can be reviewed at a later time and eventually can be integrated into your EMR system. But the minimum requirements are just on the risk factor page. Again, you'll notice the asterisk next to each required field. So once you've entered in the risk factors, you can simply press the start button. It will bring you into the main Study Hub page. So this is our main study menu. Each of these applications launches a separate window, allowing you to either manually type in the numbers, or if you were to have a Continua enabled, Continua is basically the medical grade Bluetooth standard. If you had a Continua equipment to measure point of care blood test or blood pressure, that information would automatically sync with the CardioHealth station. Because we don't have that equipment here, I'm going to simply show you how you would manually type in the numbers, for example, for the blood work. So here's the cholesterol information, the total cholesterol. You can just use the number pad here to type in. I'll enter again some template information. Press Study Menu to go back to the main page, save that data, and then you'll notice a little check mark next to each application as you've completed it. Now the minimum requirements to see a report, again, since we are calculating a risk factor assessment, we do need to see the blood test numbers, total cholesterol, HDL, and LDL if you have it. We also need to know that subject's blood pressure. So simply choosing the blood pressure application and typing in both a systolic and a diastolic blood pressure. Save the data by going back to the study menu, and then again you'll notice that check mark. Now the last bit of information required to complete the CardioHealth test is the actual ultrasound procedure, so capturing 4 separate ultrasound images from that patient's neck and carotid artery. So I'll simply choose the ultrasound imaging application. The patient's laying down, you'll simply choose which side you want to start scanning on, so I'll choose right. And then you have 4 options enabled. The first option is a plaque scan, so per the ASE guideline, we do want you to visually look for any obstructive plaque in both the right carotid and the left carotid. Once you've completed the plaque scan, you'll then move on to measure the carotid IMT, the intima media thickness. So we're looking at carotid artery wall thickness. So the advanced scanning procedure will actually be covered in a separate video. For this purpose, we will demonstrate very quickly using one of our volunteers here in the lab.